Krista Bauer from the GE Foundation. Krista, let's talk about health.
Thank you so much for inviting me to talk with you. We've got a program in GE called Developing Health Globally, and what we're trying to do with this program is we're aiming to improve the quality of healthcare delivery across the developing world. So it's a citizenship or CSR effort for us.
When you talk about healthcare delivery, do you mean in terms of delivering vials like from PATH, which is a tremendous organization that does that, or are you talking about systems?
Actually, I'm talking about the very basic system and structure. And so when we look at rural hospitals across the developing world, I'll just take Sub-Saharan Africa as an example, where we're talking about the district level facility, WHO level 4 facility, where much of the basic care that's available is really provided.
And with GE, of course, I immediately think of electricity. So is this part of what you're trying to do?
We're actually taking a full 360 view, starting with infrastructure, so power, backup power generation, water, available water, and safe drinking water, all the way down through to medical devices, training, coaching, mentoring, and the process really that holds things together in terms of making the facility function.
So we're right here at the Global Humanitarian Technology Conference, and it's pretty noisy right now, but that's okay. That means there's a lot of activity. How do you figure out what you have to do? I mean, what is the process that you go through in determining, well, this area needs X?
That's a great question, and we just actually finished up a discussion with a broader group this morning. But what we do is literally go to ministries of health and initiate a dialogue, introduce ourselves as GE, and believe it or not, plenty of people across the world haven't heard of General Electric. And we talk about what our mission is for the program. So we're not there to sell. We're not there to create a commercial presence. We truly want to help and make a difference and use our people, our process, our technology expertise to help the ministries of health drive their agenda in terms of providing health for their total population. Not just the folks who are rich or privileged or connected, but the folks across the entire country.
In the West, in the Western world, of course, we're used to some really pretty good health care. But we don't have the challenge of unsanitary water. We don't have the challenge, so many different challenges that people have. What are some of the challenges that you are finding that people in impact countries are facing?
So just to give you a very basic example, this might be further afield than you're looking for, but just getting people to show up to a facility can be a challenge. And by that I mean, just because you don't have resource doesn't mean you don't have intellect. And when you find a facility that actually has the tools to provide care, has a pharmacy that's stocked, has a practitioner that can diagnose, you come and you tell your neighbors and you tell your friends and you bring your family. When you've got a site, whether it's a health center or a district hospital that essentially is not functioning, doesn't have appropriate staff, isn't staffed 24/7, doesn't have medicines, doesn't have diagnostics, well, you're not going to go to that facility as a patient in need. You're going to go either do nothing, or you're going to have to go to a more advanced facility much further away. So frankly, the initial dilemma is just getting people to come. And what we found is once we upgrade a hospital in partnership with the ministry, in partnership with the hospital leadership, we see nearly a twofold increase in patients coming to be treated.
Do they pay when they get there?
It depends on the model of the country. We only work in public facilities that Ministry of Health has ownership of. So we're not there to create a dual system or a competing system of healthcare delivery. We want to work within the ministry system. And so some countries have a pay-as-you-go model. Other countries, such as Uganda, have a zero fee for service.
Is there a difference in discussing healthcare with women in impact countries than it is in talking with men?
That's a great question, and it can be a kind of a sticky one. I think there is. And in some cases, it really connects directly to the question of empowerment and who are the decision makers and who holds the resource in the family and community setting. So in many cases, you've got women who have strength in numbers in their communities and are really a voice. They speak directly for antenatal care. They speak directly for girls staying in school, getting education. They have, particularly Ghana is a great example, a very strong maternal line where the queen mothers are really the drivers and the movers and the shakers in the community. In other cases, it's a much more muted voice, and then it's really the chiefs in the community who really are dictating how resources are allocated, what priorities are set, and then as it applies to healthcare, who actually goes to get healthcare and when.
Do you have challenges that may relate to religious differences?
That's one that frankly we don't have a lot of direct experience in because we partner with Ministry of Health. We really keep our conversations and our work is motivated by the ministry structure. Just again by pure personal observation, the ministries are there to treat and serve their entire populations regardless of their religious differences or preferences.
So in the years that you've been working in this, what is your biggest success story and what's your success story yet to be? Let's put it that way.
That's a great way to put it. This biggest success story at a very basic level, again, I'll just reference that statistic I shared with you of, you upgrade a facility in partnership with the ministry, nearly a twofold increase of people coming to that facility, whether it's outpatient or inpatient care. At the same time, you see nearly a 50% reduction in referrals. So you see practitioners who are capable of caring for the cases that show up. That's very gratifying and exciting. The one most rewarding element of this work, and the real one I see, is on the ground when I talk to a clinician or a surgeon or an anesthetist, and they talk about their increased capacity to provide care. So an example is with anesthesia, having an anesthesia machine that delivers the modern drug, as well as a patient monitor that will monitor blood gas levels in the patient, gives that anesthetist and gives that surgeon a tremendous increase in their control over the patient. So you've got less drug delivered to the patient, shorter surgery time, faster recovery time, ultimately shorter hospital stay, and just seeing, frankly, the pride in those practitioners who have tools that they knew existed, that they at one point had some interface with, but perhaps in their local setting didn't have access to and now do. Just creates a tremendous amount of energy and a tremendous amount of enthusiasm and recommitment in them to serve their local people, and that's really what we're trying to accomplish.
And the success yet to be? Success
yet to be. Well, let me just hit it, big and bold. It's supply chain. It's how do we, as we look at a hospital and look at the hospital system, so the network of health centers that feed up to that hospital, they're ultimately connected to the Ministry of Health. And their ability to serve and their ability to provide is wholly dependent on supply chain in many facets, whether it's simple drugs, all the way through to spare repair parts, to fix more advanced equipment. The non-functioning elements of supply chain come back and bite us in a host of arenas.
Right here on Rainmakers, we have recently talked with two different groups who have created mobile health technologies that are actually tied to cell phones. Just amazing. Is that the kind of thing that you may be dealing with as well, that can help a clinician 7,000 miles away?
So GE doesn't have direct expertise in cell phones or cell phone technology, but what we are doing is leveraging some of the inroads and some of the progress made in the mHealth arena. And most recently that's been in Rwanda, where we've actually partnered up with local organizations. Access Project is an NGO that functions in Rwanda, Ministry of Health, as well as UNICEF, who's got a great amount of work going on in mHealth. And what we've done is basically working on developing what they call a rapid SMS tool to both monitor and track pregnant mothers all the way through to the first 100 days of birth. And we're leveraging at the local level community health workers who each have a cell phone that's got some very simple programming elements in it to both collect data and feed that back, but also leverage the communications as decision support so they can get instruction if they're interfacing with a woman who's having problems in her pregnancy and get very immediate instruction on what next steps to take and how to plug back into the health system for follow-up.
Are many of the clinicians that you deal with actually local to the community where they're from?
Indeed, many are. And in fact, what we found is that the ones who really stay for the long term and have the strongest commitment are going to be from the local area. So it's our frankly, one thing that we've got on our agenda is how do we help countries promote that sort of in local, for local, from the neighborhood sort of mindset in terms of placing their partitioners.
Unless I miss my guest, you've got a fun job, don't you?
I have a great job. GE does all sorts of things. We've got great technologies, and we serve all sorts of needs on the commercial side. And I am truly blessed to have a role in the company where I can leverage the expertise, the technology, and the resources to make a difference on behalf of General Electric.
Krista Bauer, thank you very much for being here.
Thank you.